Hi Lottie, I'm really excited about talking about this topic today.
Absolutely, it's a really important topic.
Very important topic. So just to introduce myself first, I'm Claire Berry and I'm a dental hygienist, which makes me an oral health expert, published author, blogger, writer, lecturer and trainer, and I'll let Lottie introduce herself as well.
All-round star. Exactly, very similar to Claire. We're both very passionate about oral health. It's a huge topic and we think there should be much more awareness about it. So that's us. So research shows that periodontal disease is higher in men at approximately 56.4%, which is huge. Globally, up to 15% of 34 to 45-year-olds suffer with severe periodontal disease, that's men. Worldwide, 150 million men have erectile dysfunction problems, which affects their quality of life, of course. ED is defined as a persistent or reoccurring inability to have a sufficient erection for satisfactory performance. Chronic periodontitis is defined as an inflammatory disease affecting the supporting structures of our teeth, which Claire and I see it all the time.
So common, we see it so much.
Absolutely.
So Lottie, erectile dysfunction is usually experienced by men, or we consider it to be experienced by men over the age of 40. But the recent studies are showing that we're actually seeing this issue in younger age groups. So even 18 to 28-year-olds are starting to experience this.
Absolutely, and 40% of men actually experience this problem before they even get to 40, and 70% suffer before they even get to 70. So it's a huge topic that actually doesn't get discussed very often at all.
No, it's not something I've ever discussed with my male friends. I don't feel like it's a common topic for discussion, but it's something that's so common, so prevalent. And if there's things that we can do to help, deal with the
Very
issue
easily.
or prevent it should be something to talk about.
Yeah. So Claire, how does chronic gum disease cause erectile dysfunction? What's the connection?
So it's caused by a lack of adequate oral hygiene. This allows the bacteria then to sit around the gum lines, and then this bacteria causes the gums to become inflamed and they may bleed when you brush your teeth. So that would be the first signs of the inflammation for you. And this process can lead on to chronic periodontitis in susceptible patients. So the bacteria itself and the inflammation then causes something called circulatory inflammatory mediators. So just to explain that, they're messengers, they act on the blood vessels and that allows it to promote inflammation. So your body wants to send your inflammatory or immune response to where the inflammation is. So an increase in these circulating inflammatory mediators, that causes an increased risk of endothelial dysfunction. And just to explain, endothelium is the lining of the vessel walls, and this is throughout the whole body, so it's all vessels, it's the lining of the walls. And if you have endothelial dysfunction, it's where you have an inability to be able to have that vasodilation, which means that it inflates and constricts as well. And it gives the arteries a lack of ability to be able to actually dilate properly. So if this was to happen in the penile vessels, if they didn't have an ability to be able to dilate or work effectively, it can affect the erection function. So what happens is when there's sexual arousal, the blood rushes to the penis and the muscle actually relaxes. And so it stops it also from leaving the area so that the penis stays erect. So if you don't have the proper function of these vessels and this process doesn't happen, it's going to affect either the sustained ability of the erection or stop it from happening altogether. So we actually want our endothelial lining to be very healthy. So if the inflammation is going to cause the endothelial lining to not be healthy, this can be a problem that can occur.
So ED was 3.29 times more likely in severe chronic periodontitis patients than periodontally healthy men.
And this has actually increased a little bit since we wrote this webinar, hasn't it?
Yeah, absolutely. So there's a lot more information and research going into this. So it will be a benefit to consider periodontal disease as a causative clinical condition of ED in such patients. You go to your GP, would they send you to a dental hygienist? Maybe not.
I don't think a lot of people know that there is this link between the inflammation in the mouth and this. We know about the links between sort of diabetes and other things that might induce sort of erectile dysfunction, but no one really puts the inflammation around the gums and periodontitis with it. So it's something that needs that awareness.
Oral health is a really important preventative medicine. So you're not only treating periodontal disease to help to cure it, but you're also preventing by keeping your gums really healthy.
Absolutely.
So, what can we do to improve oral health, Claire?
Okay, so in terms of our top tips, one of the things that I really like in a routine is stannous in a toothpaste, because it's going to kill bacteria, it's going to stop it from regrowing again as well, so it's going to affect its metabolism. You can find stannous toothpaste. Oral-B do great ones like Oral-B Pro Expert. They do the Gum and Enamel Health, which is what you've got there, Gum and Enamel Repair, and Sensitivity and Gum Calm contains stannous as well. And you'll only find stannous in those toothpastes. So definitely an Oral-B toothpaste is top of my list.
Yeah, absolutely. I'm very much into an Oral-B toothbrush as well. The oscillating heads. These new IOs from Oral-B have actually proven 6 times more plaque removal than a manual brush. The results we see with our patients are absolutely incredible. Even I love it in the bathroom myself. And using something between your teeth to disturb that plaque biofilm in your mouth. Use little brushes between your teeth, use the floss every day, and just disturb it. That's the most important thing, that soft biofilm.
So 100% our first top tips is to get rid of the biofilm or the plaque biofilm, and that's by using an electric toothbrush to remove the bacteria, toothpaste that contains stannous, getting between the teeth with floss and things like that, but also seeing a dental hygienist or a dental health professional. Obviously, dental hygienists are area of expertise, we're subject matter experts in oral health. And we personally, me and Lottie, we're GBT or guided biofilm trained hygienists. And I like that because it really focuses and hones in on the thing that causes disease and inflammation. So yeah, do you want to speak a little bit more about the guided biofilm therapy element to having treatment for it?
Yeah, and absolutely. It's a very pain-free technology. So it's warm water that uses an air and an erythritol powder to remove that soft biofilm around the mouth. We use a disclosing agent to show where that biofilm is, and then we go in and just remove that. That soft stuff is what's going to cause the harm in your mouth. And actually, that's what you do every day with your toothbrush. So yes, it's definitely the way that you should be cleaning teeth now.
So by choosing a GBT trained hygienist as well, we actually can tailor your advice based on where the bacteria is building up in your mouth, because we disclose it first. And then the erythritol powder that we use actually helps to kill the bacteria and also stop it from regrowing as well. So erythritol is a fantastic way of controlling the biofilm itself. So all the things in that whole treatment is aimed at trying to eliminate the things that causes the inflammation that may end up causing the endothelial dysfunction, that may end up causing the erectile dysfunction. And actually, there were studies that showed that if you were to have successful periodontal treatment, within 3 months, you can make a huge difference for erectile dysfunction. And in fact, some patients, it eliminated it completely. That's how close that link is.
Absolutely, it's really crazy. All I would suggest, guys, is book yourself in for a gum health check. You don't have to go to your hygienist and tell them about your erectile dysfunction, but book yourself in. Tell them that you want a gum check, have a really good clean to remove all that plaque biofilm, and you're doing all you can to prevent and treat.
Yep, great. Thank you, Lottie.
Right. Thanks, Claire. Bye.
Bye.